Good afternoon, everyone. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and I'm happy to welcome you to Session 3 of the Health and Hunger Summit series. This is a virtual series as part of a larger project where we take a candid look at connections between the healthcare system and community resources that address hunger. For this series, again this year, we're focusing primarily on southern West Virginia counties. Health and hunger are profoundly connected. Their systems should be too. You can find more information on our website at thinkkidswv.org. Let's go ahead and get started. Feel free to type questions or comments in the Q&A while they're fresh in your mind if you'd like. We'll get to them as the conversation progresses. And with that, let's get underway by thanking our sponsor for the event series, the Palatine Foundation of Huntington, for their generous financial support again this year for the project. If you are a nonprofit that serves their foundation's West Virginia service region and have a mission to advance transformative health initiatives, we suggest you visit their website to learn more about their important work and grant opportunities. We appreciate the opportunity to work with them and their support of work like this. Let's begin today's conversation by sharing some responses that we received from food resource providers from around the state. We asked them the question, do you deliver food to those who lack transportation? Have you considered delivering food? And if not, why? Here are some of the responses we received. Yes, we have many folks in our area who do not have transportation. Now with the monthly distribution, the younger folks come and fill out the necessary paperwork and Rick will take it to them, or they use a dollar store buggy to pack it home. We also have elderly folks that we know in our community that live on a fixed income and appreciate a box of food at the end of the month more than you know. They also love to see my husband come and visit the last Tuesday of the month. That was Mary in McDowell County. Tyler Mountain Crosslands Community Services used to deliver food to a limited list of families one Saturday per month. These families were homebound or without transportation. We continued the service due to a few factors. The same couple was doing it all the time. There were no other volunteers. It became costly for that couple using their own vehicle and fuel. The couple became disenfranchised. After a while, it also raised safety concerns, so the service ended. If the agency had its own vehicle and a host of volunteers, it may be that that service could restart. That was Karen in Kanawha County. Yes, we deliver to between 135 to 145 families every Tuesday for the past 2 years. All deliveries are to families that lack transportation and resources as identified by school and early childhood social workers. Currently, we have 20 routes. Families are added as social workers identify them. This requires us to redo the routes almost every week as we try to keep each route in one area or at least as much as we can. The other piece is that we have to prep for deliveries. Non-perishable food boxes have to be built and packed each week. Our regular drivers have developed relationships with many of their families and have become a social support system for them. Deliveries are difficult, but so important in our rural state, and that's work in Monongalia County. And then finally, we normally do not deliver. We are in a neighborhood and most of our clients are nearby. If they walk, we let them borrow a shopping cart to get their things home as needed. They have to leave their phone or ID with us, so we know they will bring the cart back. Once in a while, we get a client who is feeble or confused. We will follow them home with the food, and that's Linda in Parkersburg. And so it seems like all agree on that transportation of varying in degrees is needed, but a challenge. And regardless of scope of services, it's very important, but each is responding differently to the need. Knowing this, I'm very interested to start today's discussion. So let's meet our panelists in alphabetical order. Rebecca Hooker is the Executive Director of Christian Help in Mingo County. Cyndi Kirkhart is the Chief Executive Officer of Facing Hunger Foodbank. Chad Morrison is the Chief Executive Officer of Mountaineer Foodbank. And Jennifer Waggener is the Executive Director of Faith in Action of the Greater Kanawha Valley. Welcome, everyone. Thanks for being here today.
Glad to be here.
Great. Let's jump right into question one then. Let's spend some time digging in and describing and articulating what we mean by the challenges of transporting food to individuals in our more rural communities in West Virginia. And any of you are welcome to go first.
I'll start. I think some of the challenges, obviously for us, is we have very large trucks because we're trying to accommodate the delivery of as much food as possible to the right people at the right time. Many of our pantries and partners in the service area have facilities that do not accommodate large box trucks. That either they have the space, but it's on gravel or an uneven terrain, which we can't offload the trucks at, or, space alone, there isn't a larger parking lot or capacity to pull those trucks up because maybe they're pretty far out in the hollow and, the truck actually cannot navigate down the road. So that's part of our thing. And then obviously making sure that we can get there during adverse weather. A lot of those communities are off the main roads, and God love the West Virginia Department of Highways, but they have their work cut out for them in bad weather. So, sometimes deliveries are affected that way.
Cyndi, can I ask you something? So you as a food bank, you contract with many pantries and other food providers. So if someone contracts with you, do you actually have to go out and see how are we going to logistically do this?
Yeah, I think that's, part of that partnership with our member agencies is to really get a lay of the land virtually about how and when we can make those deliveries to ensure that we can use the larger trucks. At times, we have drop points. So in a county, we will meet at a congregate area, for lack of a better descriptor, and the agencies will meet us there. So some of those factors create that we are at a drop point versus going directly to the church or the pantry location.
I'll jump in as well with to kind of mirror what Cyndi said as well. It comes down to timing, and for our organization and for our neighbors that are trying to access food, we're both doing the same things. We're both on parallel paths, trying to figure out how can we utilize the resources we have to access food or deliver food. So from the organization standpoint, we're trying to make sure that we connect all the dots from receiving the food to knowing where it's going to getting it where it needs to be. And that's all timing and coordination between multiple players throughout the state. And then, for our neighbors that we're feeding, they're trying to do the exact same thing. They may be trying to get a ride with their neighbor or schedule something on the bus or just figure out if they can reach that food. So it's all this coordination just to make sure that that food is getting into those the hands that they need. That's a complex system. Just thinking about what we do as individuals when we make a trip to the grocery store, you're trying to make the most of that trip now more than ever as we're facing soaring costs. So I think timing and coordination is big factors.
I come at it from kind of the opposite ends, right? So I'm the one that's actually putting the food boxes in the hands of the people who are going to use them as a driver, as a just transportation option. We provide transportation for senior citizens in 2 counties, Kanawha and Putnam counties. And one of the services that we provide for our seniors in so that they don't lose access to their food boxes by not being able to get there to pick it up, 1 month or however, whatever that rule is, that they will get dropped to the bottom of the list again if they're not there to pick it up. It is, so many times. We decided to deliver to those folks. So we go to several different people who have the food box distribution point and pick up boxes and deliver them to the seniors that we serve, that they have to be, they're seniors within our system already. So we're actually making those trips with volunteers and just in our cars and just driving the food boxes to the seniors who can't access them. So it's a challenge. I can't imagine doing it in Mingo County, for example. I can't. That would be a huge challenge because number one, it would be hard to find a team of 300 volunteers or 250 volunteers like we have here. And number two, just the logistics of the transportation and the roads and everything else would be a challenge as well.
Speaking of Mingo County, I'm very new in this position. And one thing that I did notice is that we provided many different services and we're kind of trying to reinvent that from pandemic safety, et cetera. But in our own little organization, the little pieces weren't talking together. And I was trying to figure out what we could use all the pieces together for. And so we're the only public transportation in Mingo County. So we do have 3 vans. Well, actually we have 4, but we have 3 drivers. And we decided to use those to deliver food. And my hope is that right now we're currently just delivering the senior boxes through Facing Hunger Foodbank. And it's a wonderful program. Currently, we now have 50 recipients. And it takes our drivers. We had 2 drivers, and it takes a full day. And we are not a volunteer organization. These are staff. One thing that I would like to add, and we can get deeper into this later in the conversation, is that the financial hurdle for people who are thinking about doing something similar to Christian Help is that we have our vans and funding comes through the state of West Virginia Department of Transportation. And it's a very, I don't want to say complicated process, but it does take some time. But you're not out the entire cost of purchasing 3 vans, paying for 3 people. So my hope is to be able to, I'm reaching out to different organizations to try to actually have an on-demand pantry in Mingo County. Mingo County is very, very poor. And the clients that we serve do not have transportation. And it's those people that we're talking about today. And so I'm here as a panelist, but I've also got my big ears listening for any ideas that are coming our way, because summer's coming up, and it doesn't worry me, but I just want to be able to help as many as possible. So that's something that Christian Help has just started. And so I'm very, very happy to be in this conversation to hear how different organizations are going about it. One thing that's kind of tricky though, when you're mentioning volunteers, volunteers cannot drive our vehicles. They have to have training through the state, et cetera, and licensing and insurance. So that caveat kind of limits that maybe the scope, but that's how we're able to start this process.
That's so important. There are so many details that I heard come up as you all spoke. One of them, the logistics of working with volunteers who only volunteer certain days of the week. Ash put a really good point in the Q&A where she said, where you speak of job points, my experience with rural areas and limited bus routes is that most pickup drop points lack signage, route maps, and or schedules. Being someone who grew up in rural Tyler County, sometimes we don't notice that the sign's gone, but if you're a driver that's taking, perhaps perishables, it's a very important point. So thank you, Cyndi, for responding to Ash. To Rebecca, Ash asks, since it's summertime, are you able to make a contract with the school bus depots to have their buses and drivers help with deliveries and senior transportation?
I have not reached out to Mingo County yet. I've had a brief conversation. The closest school to us is Kermit Elementary, to see how they are operating a summer feeding children program, because that's also definitely a way in the summertime is to get other product, right? Our senior program is covered. It is what we would morph into. And right now we haven't gone to the morph stage yet. But yes, I am having that discussion on a very, very local level, and I have not reached out to Mingo County yet.
Hey, Rebecca, something I'd like to tease you with a little bit.
Yeah, all right.
Is that we are working with Redevelopment Mingo to open up a distribution center in Mar, okay, just about quarter mile off the corridor, that we will hire a start of 5 folks with an anticipated an additional 5 folks that will hire drivers. And not only will we distribute from that to folks like yourself, is that we will have kind of that front end pantry availability, but I anticipate utilizing our refrigerated van to come down in that community and support you guys with doing some of that home delivery stuff. So
Oh my gosh.
I hope to have that in place by at least by the end of the year.
Wonderful.
Yeah.
Well, that's great. So we answered some of the questions of the similarities and contrasts of the statewide transportation versus community pantry to individual transportation. What transportation lessons have we learned from the pandemic? And do we anticipate that food insecurity and transporting food will be affected with the eventual end of the public health emergency?
Well, it's more complicated than that, because as far as the catastrophic event of people dying, hospitals and our healthcare system being overburdened, overwhelmed, that is abated. But now what has happened is that you're at this perfect climax of global events. Now we have got things that are happening in Russia and Ukraine that are affecting our food system. And so you can't separate what's happening, because you have inflation that is coming off the heels of the pandemic. So we're still dealing with the fallout from the pandemic. It's not loss of life, it's all the other things the financial analysts warned us about. And so that's the problem now, is that it's not that you can't see people face to face anymore. Now it's that it costs you 3 times more in gasoline to get somewhere, and you cannot have access to fresh fruit and vegetables because your budget can't afford it. So the pandemic created this global catastrophe, a financial crisis that's affecting everyone, and it's really, really affecting. And I can talk from Christian Help's vantage point. We, up until I started in January, were 100% funded by individual donors. Of those donors, only 1% was local to West Virginia. That being said, if it's a choice of contributing to a nonprofit or paying your electric bill, you're going to pay your electric bill. So whereas the demand for my services have gone up and those requests have gotten broader, our financial base has gotten smaller. So trying to reinvent processes that we have that I can keep Christian Help sustainable is my primary focus. So to answer that question in a very long form, the pandemic being over has nothing really to do with what we're talking about for the foreseeable future. It's the fallout, the financial fallout from the pandemic. in my humble opinion.
From my perspective, the pandemic, we never shut our doors during the pandemic. So because our seniors still needed access to food and supplies, and they still needed medical attention if they were ill. So, we continue to provide those services. But what we were able to do, what the pandemic empowered us to do, was kind of reimagine our grocery program and our grocery shopping assistance program with people. This shop and drop system where, if they have a family member who could place the order online for them, then we can have a volunteer who could pick it up and deliver it. We can even place the orders online. We have volunteers who do that for them, and then we pick it up and deliver it. And that program exploded during the pandemic. Obviously, that was it. But the thing about the post-pandemic, we're not really post-pandemic, but in this aftermath that we're in now, that program continues to grow. It continues to be an effective way for us to help people get nutritious food and supplies into their homes without putting them at risk in any way, or and it's a lot easier to schedule because you can do it anytime. You don't have to, we don't have like dates and times where you have to be somewhere. So anyway, that program has grown and expanded, and it's now the grocery shopping assistance is our second most utilized program of all the work that we do. And it doesn't sound like it would be transportation based, but it's absolutely transportation based. It's transportation based in that these folks have no transportation and they couldn't get to the store on their own. So, developing these kinds of programs, we have now 7 different ways that we can assist people with grocery shopping, and that's the beauty of being a small private nonprofit and being flexible and being able to, not have to answer to the tax dollars, things like that. So, which is one of the innovations I think we need to start considering. I mean, is the federal government, is the state government, is this always going to have to be something that's funded in such stringent ways that your kind of hands are tied when it comes to innovation and being able to be creative with how you're delivering your services? The reason I started this program is because I didn't want any of that, because we were filling the gaps that exist by virtue of those obstacles existing. So, maybe it's an innovation thing that we need to start talking about it with the transportation, and it needs to be a little bit more broad and more encompassing than strictly food. I mean, food is a big part of it, but I've mentioned this earlier when we were talking before as a panel. But I think transportation by itself is the obstacle. It's an obstacle for a lot of people, where it comes for a lot of different things that affect their health and affect their quality of life. And I think we need to address that root issue, and then it would feed out to a lot of what we're talking about here today, as far as the hunger and getting food and getting access for people. It's a huge problem in this state.
Circle back with you on that for just in a minute, Jennifer, because I think it's a really important point. Chad and Cyndi, is there talk? In my neck of the woods, we've been having a lot of conversations about what happens when the public health emergency ends, because, for example, there's kids who were on Medicaid and CHIP, where there was continuous enrollment, so they were never dropped. And now there's this concern of, if this happens in October, what's our plan for all these kids who may lose their health insurance? Are these same kind of dialogues happening on your end when it comes to, did you get supplemental funding when the PHE was established?
Yeah, we continue to go from crisis to crisis, I think. I think it's just like Rebecca was saying, earlier, there is this slowing, I guess, of the pandemic, but we have this burdening other crisis, and that's been, the last 5 years we've been working through that, longer probably. So we are going to find some cliffs that we're going to run into. And I know for the food banks, we started seeing some of those at the end of 2021. Some of those pandemic funds for nutrition and federal nutrition programs started to expire. So all of a sudden, at the height of the pandemic, the spring of 2022, some of our federal nutrition programs were at the lowest that they've ever been. So those are challenges we're going to continue to face and continue to try and build, support for at the federal and state level. I did want to circle back to something that Jennifer had brought up with your question about lessons learned with the pandemic. I think we exposed our strengths and exposed our weaknesses as a state. And those are opportunities for us to learn and build and be ready for the next pandemic, next disaster, whatever it may be. We know what we need as far as infrastructure. We know that there's transportation networks and collaborations that need to happen. And we have the opportunity to do it now. We've identified so many different weaknesses and strengths that we know where we can build on, and we know where we need to really firm up on. And I think that's something that's a takeaway that we can't take advantage of, or can't not take advantage of. That we have had funding come into the state, people looking at nutrition in different lens than they ever did prior to the pandemic. Every family was directly impacted, and there continue to be directly impacted today as you go to the grocery store. There's nobody that doesn't feel the pinch. So we need to take advantage of those opportunities and really put ourselves in a position to where the next time we're having not these same exact conversations.
Pat's made some really great points. I will tell you that just to respond to the initial question, the food banks both have had to pivot quite a bit about the way that we did food delivery from the very start of the pandemic. And I will tell you that many of those things will remain in place long after the pandemic piece of this has gone and we're in the endemic. Because it just, as Chad said, it pulled the Band-Aid off of kind of patchwork of ways that we have as a society identified food delivery and food systems. So congregate feeding sites, were no more during the pandemic, and many people could not get to the food resources they needed. So we started doing so many more mobile deliveries and ultimately purchased that van where we could, facilitate home deliveries. The food banks have options like Order Ahead, which is a software that will be able to have families, and specifically for us, the medically indicated food box program, where folks can select their foods. We can determine if it's a delivery or a pickup, and really drill down into getting the right food to the right people at the right time. We don't seem to have the burdens of government in terms of funding, but we do have some limitations, obviously, with the structure to deliver. We have relied very heavily in the past on box trucks and tractor trailers. Now we, are drilling down into that community level where we do need the vans and refrigerated vans to, meet the folks that need our services where they are. So, but that's costly. And, we are, similar to everyone else, driven a lot by donations and support from the community. And we will continue to do exactly what we're doing right now with more mobile deliveries, more mobile pantry distributions, and expanding that work, and, engaging with our partners across this network. And Jennifer, is one of those, that we don't have to reinvent the wheel. We can certainly, though, come together and, create that foundation for making access, a capacity for everyone.
That's great. Thank you, Cyndi. I'm going to have a great time taking notes because I'm learning so much, so many new things that I think are so important to share with others. Rebecca and Jennifer, I would love to learn a little bit more about the logistics. So you two deliver food to individuals' houses. How do you do it? What does that look like? And I think you touched on a little bit. How do you fund it?
This is Rebecca. I did touch on a little bit. Our funding is private individual donations, except for the transportation unit. And as Jennifer said, that transportation is the elephant in the room. And so up until the delivery of the senior boxes, we provide transportation to anyone in Mingo County for any reason but a drug deal. So mostly it's going to the doctor, it's going to the pharmacy, it's going to the grocery stores. But if you wanted to go see your grandmother, if you wanted to go to the movies, anything like that. So the funding, I've touched on that. But the logistics of it, because, thank you to Cyndi and her team for actually taking the time to put those thousands of senior boxes together. So they're delivered to us. We have a wonderful storage area that we keep them on that day. Our team loads them in these vans and they go in pairs though. That's for two reasons. Safety is one of those. As well as the boxes are kind of heavy and we have an all-female staff and some aren't really able to do that. But it is for safety reasons. Most of the area that these that our drivers go to does not have cell reception. It's so funny when I listen to people complaining about broadband and broadband doesn't go to this place in West Virginia, and I just weep. If they only knew. But so and it does, because the places they're going up the hollers, but they do know these routes. That is how we selected this beta group, was our clients who currently use our transportation service to test this out and see how we liked it. They certainly have liked it. One thing that Christian Help has done is that we supplement the boxes with something. The first delivery we supplemented with eggs, milk, butter, bread, and a sack of potatoes, because we all know the senior boxes they're supplemental food to get the seniors through the month. They are not, but they really enjoyed having that. The next month we did coffee, a bag of oranges, something else to go with that. So the funding part for me, I was hoping to, I guess I just hadn't met my local Walmart manager in my times there as a personal shopper, but I did get a very small grant because they weren't familiar with us, of $500. So we used that the first time, and we only had at that point 25. So we used that 500 to purchase those, and I'm going to call them value added items. But he did not do that the next time. So we're absolving those costs. But those days, again, I'm a little bit worried about the driver. We do have a grant in progress by the wonderful students at Marshall University, and we actually might send a nurse or someone out, especially since we are dealing with the senior population, to check vitals or to answer any questions or things like that. So the pair in the next couple of months might actually be a professional in another capacity.
Oh, that's fantastic. So tell me, how do you identify new recipients?
How do we identify new recipients? For our small organization, everybody knows everyone in Mingo County. It's a very, my mother is from Matewan. I, however, was born and raised in Atlanta. I've lived in West Virginia for 8 years now. When I introduce myself, because my surname is not familiar, in the same breath I have to say, but my mother's a McCoy from Matewan. So you get that familial relationship. So mostly it's, well, our drivers actually approached the people who are using our transportation services to get to doctor's appointments, et cetera, and asked them if they would be interested. And of course they were. So that was the first round. The second round was word of mouth. And since the next week, we'll be getting our third. And so I think we're going to stick with the third, and then I'm going to get on social media. I personally don't have a personal Facebook page, but that's how our audience communicates with Christian Health. They follow our social media. So that's how we got the seniors for these past 2 months, and it will be the third. It was knowing the community and knowing the people in need, and then word of mouth for the second.
Thanks, Rebecca. Jen?
Same question. So our seniors come to us from a variety of places. We get referrals from other agencies that serve seniors that can't provide the services that we do, and so they'll refer them to us. We get referrals from United Way 211. We get referrals from doctors' offices. We get referrals from in-home health agencies. And then the person is welcome to call us themselves. We get a lot of people who find us on the web, or family members who find us on the web and come to us that way. We get seniors every single day that call and ask for an application, and we send out an application to them. So they come from all of those places. We don't go seek them out. They come to us in that way. And then word of mouth, of course. And once we start serving somebody, and then they have a sister-in-law who lives, in St. Albans who could use some help. And so they get to call for an application and that sort of thing. So that's how they come to us. And they come to us traditionally for our core service is transportation to medical appointments. The transportation is the first hot button that brings them to us. Once they learn about all the services that we can provide in addition to that, then we fold them into the mix for everything that we do. But we only deliver the senior food boxes to people who are existing clients of ours. So, and it's a one-on-one delivery. Volunteers sign up to make the deliveries, and they come here and pick up the boxes and take them to the person's house, and that sort of thing. So it's a one-on-one. Everything that we do is one-on-one, direct, volunteer to care receiver.
Again, Jennifer, how many volunteers do you have working?
257 at the moment.
Wow. And how many paid staff do you have?
2, me and my coworker. Our budget is teeny tiny. We don't spend a lot of money to do what we do because the volunteers are doing the direct services. They're supplying their own gas, their time, their energy, all of that stuff. We don't pay them for what they do for us. They're out of those 257 volunteers, though, I should say, we have 4 core programs, and then we have 3 other programs that happen throughout the year. So of those 257 volunteers, not all of them drive like to doctor's appointments. Some of them do grocery, or prefer to do the grocery stuff. Some of them prefer to make, reassurance calls. Some of them prefer to do the honeydew cruise, the handyman things like grab bars and handrails and things like that for folks. So they're all doing what they want to do, what their talent, what talent they're willing to share. So, it's not like I have 257 people out on the roads every day, but there's, probably the vast majority of them do drive, but they're, so they're all kind of split up into different areas of service.
That's amazing to me. So do you have to do like robust recruiting?
We do, but it's funny because we've been here 8 years now. So when we started, it was a trickle, just getting people to even understand what we were trying to do and the concept and why is this needed. You have the county aging programs. Why don't they, don't they do that? And yes, they do, but people fall through the cracks and they can't qualify or whatever the reason is. And so it took some time to get some traction, but once we did, I think that the attraction of volunteering with us is one, because a lot of people just love seniors and they think of their grandparents and they think of things like that, and people enjoy working with the seniors and know that they need the help. But the second thing is that the way we operate is so flexible. So we have some volunteers who live in Florida all winter long. So they're not here. They don't even sign up for anything all winter long. But when they get back, they log on to the schedule and they self-schedule themselves. They sign up for what they want when they can. It's a no pressure. You don't have to submit so many hours a month to be part of it. I mean, we just want your presence. And if you can take somebody one time a month, then that's wonderful. If you can do it one time every 6 months, then that's one less thing I have to try to fill with a volunteer. So, we're very, very flexible. And I think that's why it's so successful as far as, retention and sustaining that volunteer power.
That sounds like a great program. While I'm talking to you, Jennifer, I'm going to circle back. When we had our planning session, we discussed the importance of, if you're going to do transportation, because every social service has a problem, a challenge with transportation. With so many other social supports in the same boat, lacking transportation, do things like taking patients to doctor visits, delivering medications or supplies to those who cannot travel. Perhaps there are ways to collaborate. What's everyone's thoughts on this? And what would that kind of collaboration look like?
I have a big one. Can I just start? Nothing frustrates me more than driving around Kanawha County or Putnam County for that matter, and looking at all the churches we have, hundreds of them, churches everywhere. Just in one community up the road, there's 11 steeples that you can see on one stretch of road. And they're everywhere. Most of them, a lot of them have vehicles and vans, right? That sit in their parking lot all week long and don't do anything. And I would love, and I'm on a big mission, and I'm going to be Mr. Allen's biggest nightmare here in the next few months. But I want these churches to unleash their vans. Let a volunteer from the church who's able to use their vans and help us bridge this transportation gap problem. Help us, get into the community and help people with this huge need. I only serve seniors, so that doesn't mean I only see seniors in need of this. I mean, there's lots of families on the East End where I live who walk everywhere because they have no transportation. So they're limited to their little, to the area that they're comfortable walking with their children or whoever. It's just a huge, huge need. People can't afford cabs. They can't afford the unreliability of some other transportation models. They can't access a bus stop because their house is just a quarter mile too far or whatever. There's reasons. There's always an obstacle about why people cannot access transportation. But there's also so much opportunity that exists that we're just not tapping, and that frustrates me so much. And that's really kind of the mission that I'm on for the year to come. that's the mission that I'm on, is to get these churches more engaged in this kind of meaningful work that helps people put food in their bellies and enables them to get jobs and a whole host of things. But yeah, so that's my personal little high horse that I've been riding here lately.
It's a horse. Anyone else want to answer that? How we can collaboratively kind of address transportation on the local level?
I think it's really important that, and the pandemic, I think, really brought this into clear focus. It's easy to assume that the safety net that people think they know about that remains in place. But what struck me during the start of the pandemic in particular, again, is how easily those informal networks of transportation fell apart, right? People couldn't give rides to their neighbors the same way. People couldn't get out and about the same way if they were sick or, if there was a risk of exposure. So I think that it's very important that we even start right in our neighborhoods to look around and see our neighbors and recognize, they don't drive themselves. They, frequently have someone come and pick them up. And to Jennifer's point, utilize all of the resources in the community to really get to know our neighbors in need. And, through that, we have a much greater understanding of the need itself. versus we think we see a few people get on a bus or they take a cab. But, if we really go beneath the surface, I think we'll find a lot more. And then there becomes the benefit of, yes, that church could use their vans to do X, Y, and Z, or the food banks could, go into a community that maybe we didn't have awareness of. I mean, we have grant funding to really get into those remote and rural areas. So I think that the more information all of us have, the more we can do together.
It's a great point. Cyndi, you touched on something that I've been thinking about as we've had this discussion, and that is, smaller communities and, communities probably 30, 40 years ago had that sense of community where you noticed a neighbor and help or a need and you helped them. I was thinking of, my grandma who lived in Wellsburg, so Brooke County. When she was, in her 80s, the police department would call the senior citizens every morning to make sure they were okay. And sometimes they would stop by. And that's, kind of that sense of community for a variety of reasons isn't the same as it used to be. And when you get to larger, it sounds like they still have it in Mingo. But I think when you get in larger counties, when you have a more dense population, it becomes easier to lose your neighbors and that camaraderie and identifying when they may need your help.
So that's what this model, I didn't create this model that I'm running here. And it's in 350 communities across the country. It was actually created and established by the Robert Woods Johnson Foundation 40 years ago. So this is just a model that I wanted to bring here because it addressed all the things that I wanted to focus on. So this volunteer caregiving model is something that even in this community, neighborhoods aren't the same, neighbors aren't the same, communities aren't the same as they used to be when I was growing up. I used to have to tell people all the time I had 7 sets of eyes on me everywhere I went when I was a kid. Well, you just don't, it's just not the case any longer. So what Faith in Action attempts to do is to bring all of these organizations and agencies together who have a common goal and a common mission, and we're all here to help each other, right, as agencies and as organizations, and create a community out of that, right? So it may not be your next door neighbor, but you still have a neighbor to neighbor opportunity. You still have neighbors looking out for you. It just looks a little different. So our community and our neighborhood, the Faith in Action neighborhood, just looks a little different than it did when you were growing up, but it achieves the same goal. And that's what we are trying to do with this program, is to reinvent the neighborhood in a new way that's still as effective. So I love that you said that about the neighbors, because that's why we make our reassurance calls and we reach out, and if we haven't heard from a senior in a while, we call, we go visit, or and it's important. It's important that they know that someone's out here looking after them or cares about them or understands that there even exists, which is a big thing. So yeah, so that's what we're trying to recreate, that feel and that actual action of having a neighborhood.
A great program. Anyone else want to share on that thought before I move to the next question? Okay. What will it take to address transportation challenges statewide and locally in West Virginia strategically? What would next steps look like?
I'll kind of kick off, but I mean, having all those right partners and organizations like Jennifer's and Rebecca's, and bringing in everybody in those communities. I think you're going to have that level of collaboration to have continued support, because we've got probably thousands of organizations doing work independently in the state, and sure, there's going to be crossover, things that are being duplicated, but we've got to have those organizations working together, and that's going to be a big lift, as anybody that's done those types of collaborations. That's a big lift because a lot of groups own and want to own what they do. But they're going to have to really own what's best for their community. And, I think getting them together and starting that planning process, and I definitely don't have the plan, but I'm sure there's folks out there way smarter than me that could come up with, community plans, maybe replicating what's going on in Mingo and Kanawha and Putnam County, using them as models. So those are, to me, great starting points, because there's people out there that want to be actively involved. Cyndi and I can see it from all 55 counties that, people want to make change in their communities. They just sometimes will have to have something to model it from.
I completely agree with you. I think that it's very helpful for me when we have conversations like this to hear what other communities have going, especially something if it's really working. It's just getting those people to in the same place where they can hear from others and then replicate. That's a missing piece I think we have. So I'm going to ask my next question, and it's kind of long, so hang in there. One of the continuing challenges we're finding as we are having these discussions with the Health and Hunger Project is that there's an interest in responding to our challenges on the local level, like having community transportation programs or bringing in or sustaining a grocery store in a community or a farmer's market that works with local farmers. But we're not finding a lot of interest from local policymakers to address these issues. What are your thoughts on this? Have you tried engaging local policymakers, and are they willing to use community resources to address hunger?
I'll be glad to jump in. I think we have to look at everything in this area as holistic, because I think whenever you're looking at policymakers, they're wanting to solve as many problems as possible, and if it's creating something as far as microeconomies that are self-supporting, that's a win-win for the community as whole. So, just for example, if you're buying local produce, you're creating jobs. You're creating those microeconomies so that people have the food that they need, and they are putting people to work, and they're creating sustainable economies. And I think we have to really wrap all of the policy asks and all of the programmatic things that we're doing in that light, because it's got to be built to be sustainable. And if it's just give, and we're not building a system that starts to sustain itself, then it's not going to get supported, for one, and it's not going to be successful. So I think as far as from our organization, we have really looked at those types of programs. How can we provide resources and feed into those communities so they can do things, not just us showing up, here's food. We do that every single day. But when we're really trying to build programs, how do we build systems that allow people to be successful long after our trucks have pulled out of there?
I think that's a great point, Chad. And I think that one of the key points that you made there really is about packaging information, regardless of how we all feel about divides politically in this country, in this state, in our communities. The idea that transportation is only an issue for the poor or people with poverty. It is not. West Virginia, I was born and raised, as many of us were. It's been a problem from the start of my life, and no doubt will still have some challenges at the end of my life. But packaging it to help folks understand that all the goals of holistic living, like Chad said, can be met by adequate resources to get to where we need to go. would be transformational in our state. And throughout this journey that, started long before the pandemic, when we had the teacher walkout and we're addressing child hunger, we're addressing hunger every day. It doesn't come up for us when there is a crisis. It is every day. And the crisis just brings the public to the table more. So I think if we really focus on the momentum of keeping that public engagement, then the policymakers and the people who are making decisions will hear, all of the stories that we're representing on a small scale here today. We serve 130,000 people without considering the pandemic. We have 130,000 stories. We have a majority of our folks who are underemployed or unemployed, or, working families who are doing their very best to not have to utilize emergency services or safety net services. We've got seniors who didn't count on being, without a retirement or health care because a company went bankrupt. If we're able to represent all of those stories and to bring that comprehensive package to policymakers, I think that's the way that we'll get them engaged. They have to have that sense of urgency that we feel regularly. And I'm not sure that maybe we've been successful in doing that.
Oh, you gave me chills, Cyndi. I'm going to have to write some of that down because we're talking to some policymakers next week about, ways we can better engage. And I think that you really hit the nail on the head there. Anybody else have any comments before I move to the next question? Because we discussed this during our trial run, and I think Chad had a pretty great program that's coming up. If it's not feasible to improve community transportation issues to address food insecurity or access to healthy food, at least not in every community, what are potential alternatives and what do they look like?
So I guess you're looking at me then. Well, I think what we talked about previously was utilizing some of the other industries that are doing this work already in different fashions for different reasons. So I know, actually tomorrow we are kicking off a pilot with the delivery services, DoorDash, to deliver food, perishable food, to households in the southern part of the state, Mercer County. Actually, I'm sorry, that's today doing that. So I'll have more feedback later. So partnerships like that, these industries they're doing these things, and you think about all the different industries that have thrived, from Amazon to just all these different food delivery systems that have kind of came up. But how can we piggyback with those? How can we unite with them in some manner? Because to me that's a great win. If they've got people that are earning a living, making money, having jobs, we can support that, and they can also get the food into communities that we're trying to serve. That's a win-win. Now that's not going to be in every community, and a lot of West Virginia is very rural, so we're a long ways from that. But let's take advantage of it where we can. So I'm excited about that because there's a lot of those families, as we all know, that can take advantage of these services. So I'm super excited about it. Hopefully today went well, and we'll definitely keep everyone posted.
Great, thanks. Anyone else have any other ideas? Okay, I'll move on to the next question. We know that some of you participate in a program to deliver healthy meals to seniors, which is a large demographic here in West Virginia. It is essential to provide healthy options to them, especially when they may have restrictive diets. Do you have any ideas on how we can build on this program to include more people and perhaps even younger populations?
I was a little bit, this is Rebecca, I was a little bit thrown off when you were saying meals, because Christian Help doesn't deliver meals. I don't know about Jennifer.
Don't.
That would be great, but we could only do 12. Sorry, Ed. We could only do 12 out of one van a day. So if you substitute senior non-perishable foods for meals, that's what maybe I could talk on. And we are trying. What does it look like for my little organization? It looks like funding, so I can support it, because I'm going to have to buy the product to give to other populations. So it's come down to a money issue, and I have written grant after grant after grant, and I'm either really horrible at it or I'm just way too impatient because I guess the wheels take a while. But I think it was Chad who mentioned something, or we were talking about legislation to see if they care. I've got grants with my local, my state, and federal, and so we'll see how much they care. So
yeah, we've talked about kind of the many challenges of trying to ensure folks get nutritious food, right? Particularly folks who can't, who don't have transportation. So, specifically older populations, because once it becomes healthy, it often becomes much quickly more perishable, right? And so that's the food that we really want to see get into these very specific haulers in these, very hard to reach areas, and they're the most difficult to, the shortest shelf life. And so it seems as if for that specific population with this very specific kind of food, there takes almost a very specific strategy.
mm-hmm.
Yeah, the clock starts, from the moment it's picked and delivered, especially to our organizations, and how many times does it pass through different hands to get where it needs to go. And obviously we want to reduce those transactions as much as possible, because when you're talking about fresh produce, it's depending on the product, it's got a short time span. And you want to give our neighbors that are using it as much time with it as possible. And that's a big challenge, because there is so much coordination with that, because you're either getting too much or too little. It's hard to get the perfect amount of that product. And I know food banks deal with that, and our member agencies deal with that. It's kind of either boom or bust whenever you're talking about that fresh food. So you have to make do and make it go where it needs to go as quickly as possible. I know for a lot of feeding programs, it's difficult depending on how often they're open. Now, if you're open 5 days a week, you've got 5 days to utilize that product. If you're open 1 day a month, well, if it doesn't hit at the right time, those neighbors aren't getting anything out of that. So there's a lot of challenges with that coordination. And then it becomes like Rebecca mentioned, it becomes a resource and funding issue, because the cost goes up. If it's something that's not produced locally, it may be freighted from across the country. It may be coming from out of the country. Those costs are always passed on to someone and someone somewhere. So it becomes very pricey to move those foods. So cost and logistics are just there at the center of all of it.
That's a great point. Anyone else want to tackle that one before I hit the last of the top 10 questions? What would you like attendees to know about this issue that we may not have touched on during this conversation? What important points have we missed?
I just have one. You can do something about it. You can help. individually. You know, while we're waiting for a big strategic plan and a big collaboration and all of those things, there are things that our residents of our state that are a little bit better off can do to mitigate these issues for their neighbors. So you can make a difference right on your street. So don't wait for something to come down from on high and fix the problem. And you have to be part of the solution. This is a community effort, and you are the community. So that's the only thing I would add.
I would say that, don't buy into what are now sound bites and a narrative that people are sitting back waiting for us to do. More often than not, I bear witness to young mothers with a couple of toddlers who are riding a bus, carrying groceries, and they aren't all doing the right things. They're paying for cabs to go so that they can see their child in a school performance. We're not talking about people who just are, I think the phrase is on the till, and are not trying. We're talking about transportation needs for communities of all ages that need us, and they are trying, and we can do better. There are many states around us that have transportation. Ohio has a bus that goes from Columbus to Athens to Cincinnati, and you can pay X amount and get to a larger city to access healthcare or whatever your need is. Those are the kinds of things that we can do. Appalachians are hearty, helpful people. And it is kind of time that we remember where we came from, because I heard that a lot as a kid. You need to remember where you came from. And look around and understand that this is not a poor people problem, not a old people problem. It's a problem.
Agree.
Kids in rural communities that won't go to Marshall, because their families can't come to visit them, or they can't get back home. That's life altering when a child decides to leave an education because they miss their family so much. Those are the people we're talking about, not just people in need. Food is a right, and anything that we can do to support that, among many other rights, to a healthy life, to a happy life, this is the time.
Thanks, Cyndi. Chad or Rebecca, it's hard to top that, isn't it?
Well, one thing that I can't believe that addiction, that word hasn't come in this panel at all, but when I volunteered at the elementary school, out of a class for the second grade had 38 students. Of those 38 students, 2 had a normal family unit. 2. And the others were being raised by grandma, grandpa, Aunt Susie, uncle. You could not say, take this home and have your parents sign it. So I think in this community, Christian Help sits 75 yards from the heart of the opioid, ground zero, as stated on the Congress floor. Ground zero of the national opioid epidemic is in Kermit. And daily, our brick and mortar building has people who are in the throes of addiction, who are starving. Our food pantry is open Monday through Friday. But that still has a grip on this community. And so that's one thing that I wanted to share. And I did know, since you're speaking with legislation, the importance of seniors getting money for food so they can feed their grandchildren they are raising. It's catastrophic in Mingo County. And that's something that also There are huge federal funds available for things when you mention those kinds of words. But it really is bouncing off the subject of transportation, but you're talking about holistic. And I do know that a normal family unit is very difficult to find in my area. And it is the seniors who are absolving all of the responsibilities for the multiple children, et cetera. So I wanted to bring that piece into it as well.
70% of the grandparents in Mingo County are raising grand families.
Yes, ma'am.
That is, we see that with the medically indicated food box program. So then we're providing other foods for those families because, we want them to raise those kids without those chronic diseases, but they still are, they need the basics of hunger relief. So I appreciate everything you're doing there, Rebecca. We'll continue to do more.
It's a wonderful point. Thank you for bringing that up. I'm going to take a break for a moment and see if anyone who is watching has any questions or comments that they want to share before we move on to the bonus round, where we ask some quick questions that are open to anyone who is on the panel or watching on their computers. Okay, we're going to jump in. We've considered holding a multi-system and sector state conference to discuss the state's public transportation problem to see if we can create collective solutions. Who do you think needs to be at that planning table?
Every one of your lawmakers. I was just thinking about that. If anybody needs a question to ask to your lawmakers, is what are you doing about transportation services in West Virginia? Every one of them needs to ask that.
And prohibit them from driving themselves to the meeting. Let them take public transportation to get
Figure out how
there.
to get there.
There you go.
So legislators, who else? I think healthcare is a great partner to have at the table. I remember years ago being in Pendleton County and sitting during their Monday morning meeting at Pendleton Community Care, and they just started naming off the patients who couldn't come in to get their medication because they were just going to have somebody drive them out. Small community, they knew where they lived, they knew that they didn't have transportation. And so we know that this, especially with, we know that seniors have more prescriptions, than younger generations. And so it seems as if, our FQHCs, our hospitals would be important allies in this conversation.
I think you need to have leaders from industry too, because this issue is just going to continue to snowball into, we struggle, the state continues to struggle to find employees. And we're going to continue to do so because this is the environment that we're creating, and they have to be a part of that. So I think your manufacturing and your corporate leaders need to be a part of this because they have to be a part of the solution.
And for another reason also, because a lot of the folks that we help, their families are working at these companies and can't take 5 days off a month to get their mother to a doctor's appointment, right? So that's where we come in, and we're able to mitigate that so it benefits the company to have some sort of access to transportation like that. So yeah, I think that's critically important.
And let's not forget the very people who need transportation.
Exactly, a great point.
To tell the story of what it's like to make connections, to get, to wherever they're going, if they do have access to public transportation, and the cost of that. Look, my mom would catch rides with people, and sometimes people wouldn't do it for free. They wanted money. So you're taking money for something dedicated to medicine or to food to pay someone to take you someplace. So those stories have to be told, and the best people to tell them are the people who are living them.
There's even younger people who could have a job, except they don't have any way to get there reliably. And so they therefore they can't take the job. And so, I mean, it's almost become a full-time job just to be poor, because you can't seem to grab on a bootstrap.
It's the cycle. It's the cycle. I do know that a program, Workforce West Virginia, has some interesting programs surrounding transportation. And I do know, I believe it was Scott Adkins that I saw that they have a program. It's for obviously job creation, employment, but it was addressing the transportation issue. And if you were hired, and I think if you had 60 days notice or something like that, worked for 60 days, that you could work with this particular car company or car sales, and that you would get the loan. And it was a loan.
That's good news, Mountaineer Garage.
Yeah.
Yeah, and they facilitate low interest, no interest loans for people to get cars for.
Oh, I thought it was Jason Miller's lot. I thought he got that big.
Around here, it's a similar thing, but
Okay.
Garage is the one. They get donated cars and come up, and you can't just go and say, I don't have a car, I need a car. You have to be part of the workforce program to qualify.
At any rate, they might be really good to have at the table as well, because they could maybe expand that program to seniors. Who knows?
Jennifer brought up a good point about young people, because I was struck last summer during summer feeding that 2 young men in one of our counties hitchhiked to the feeding site because they were that hungry.
Mm-hmm.
And one of them actually the next time rode a riding lawnmower up. So, again, those stories, but how it affects our young people. If we want to change multi-generational poverty, we've got to give people hope that, there are ways that they can get to where they need to go and stay here.
Wonderful point, Cyndi. And it's so important, because it has struck me a couple of times at the legislature when I've had legislators share stories with me about the poverty they saw when they were poor. And that poverty is still there, and it's people are still living these lives, but they don't see it anymore. So it kind of, that detachment has,
Disconnect.
Yeah. Yes. So next question, how can we better utilize 211 or potential other resources to address the transportation problem? Are we sure people in need know where the closest resources are?
I think this is a big one, because, you're going to have a centralized source. You're going to get redundancy of effort, and you're going to get duplication of effort, and you're going to get people spending money on, the same thing and accomplishing very little. Where if you have somewhere where you can go and you can see and access all the resources that are available to meet your particular need, I think that that's vital to any of this being successful. And I'm not sure what's the best tool. I know 211 is now using the findhelp.org system, and they actually have staff that keep that current and updated and make calls and keep it, so it's as real time as it can be. It's not perfect, but it's it's better than it used to be. But it's just, I feel like having something like that where people, when I started this organization, for example, I did so much homework to make sure that I wasn't walking on stepping on somebody else's toes and filling a need that was being met elsewhere, just to create something. And I don't think people get an idea. People see somebody who's hungry and they want to feed them, and so they start a program. They don't know that there's a program down the street, and if you help them, you could feed even more people, that kind of thing. So I feel like that kind of awareness of what resources exist in the communities that we serve or in the state that we live in is important.
I agree. I think one of our biggest challenges is that we and even our institutions in the state are kind of bad about this. Is many of the programs and services that we have are grant funded, and so the program starts, a page goes up on the internet, and then it ends, and then people who are looking for programs and services start Googling, because that's what we do, and they keep running into barriers, closed programs, something that doesn't exist anymore, and it can be really defeating. So But I also think that we mentioned social media before, and I do think that's where a lot of people are getting their information now too. And so that is one good way that that information does keep kind of updated. It's just not really as centralized as we're looking for. Let's see. Schools play a critical role in this space. Can we build on these relationships, like better community accessibility to school buses and bus drivers? I think that both food banks partner in some capacity with schools, certainly have before.
Yeah, I know we've seen, during multiple times where schools and school buses were, primary distributors of food. They would deliver food to bus stops. They would deliver foods to houses. Schools would be a location that people could come and access food. So we think of, schools as being, central parts of every community. So it only makes sense that we utilize them for this type of project.
Yeah, it's something that we're going to talk about next week, is that there's homeschooling, charter schools. We're seeing kind of a decrease in enrollment in schools. Not sure how that's going to play out over the next few years. But at the same time, we're still talking, when we speak of child hunger, we're still looking to the schools. And so it seems as if we've got two things going on at the same time that could be really detrimental if we're not careful in ensuring that all kids have access to healthy food. So one of the last questions, how can we improve and build social capital around the importance of accessibility to healthy food for all West Virginians? Who's already working in this space, and how can we help them? So do you have any shout outs or ideas for people who want to advocate?
Well, I think Cyndi has said it a couple of times. I mean, getting the stories out there. I mean, the stories are powerful. They are gut punches a lot of times. And, if you can get these stories out there in front, especially in front of the right people, or, I think that's one of the most powerful ways that you can build social capital.
That's a great point.
Well, I think that we've all touched on that the pandemic created new customers for a lot of different resources for us, for, breakdowns in healthcare provision and access, all kinds of things. So if we can kind of keep people remembering that, look, the average middle-aged or middle income family does not have resources for an emergent situation. It could be you, I think we all know folks that cars have broken down. How do you get to work if you don't have any type of public transportation? Again, it's, bringing those stories to people and helping them recognize that they're only a couple steps away. The pandemic certainly emphasized vulnerability of income and employment. So our job is just to carry that on throughout, because there's always, like Chad said earlier, there's always a crisis. There's something, right?
Well, I don't know what the median or the income levels are for SNAP. But every day on my way to work, I listen to the same radio station. Love it. Sometimes I get music. Most of the time I get the commercials. And a commercial that's played multiple times daily is for a golf course in Kentucky. And where Christian Help is located, we also service Martin County, Kentucky. We are literally right across the river. We have the bridge right here. But so this golf course is paying broadcast money during prime hours to advertise for course maintenance. This commercial has been playing for about 3 or 4 weeks, and it is advertising a maintenance position at $8 an hour on the radio. Okay, couple things hit me there. Don't do the broadcasting, pay somebody $14 an hour and somebody be working for you already. But, and I know that Kelly, that you will not be working with legislation in Kentucky. However, Kentucky still has a $7.25 minimum wage. If you do the math on that, someone is working full time and can get every government benefit. That's criminal. Period. No one should be forced to that indignity. No one.
Agree. We force them into these situations and then we stigmatize them for needing resources.
Yeah.
It's a no-win situation.
Yeah.
But I completely agree. I think that it becomes really difficult, again, because of stigma. I'm surprised in 90 minutes we haven't discussed stigma. It didn't organically come up, but that, for me, has been that real barrier to getting people to share their stories. They often want to share that story after they've kind of gotten out of that situation. And then we talk about it in a way of, here's the example of how you get out, instead of saying there's really no shame in it. You know, everybody needs to eat. And Cyndi said you have a right to food, and we're the richest country in the world, and we should be able to feed all of every West Virginian. It's the logistics that we should be focused on. But yeah, so
the sad part about it is in Mingo County, it's not a stigma because it's the norm. The population here, it's not. I've never seen any. I personally know people that don't have indoor plumbing.
wow.
Yeah. So it's unbelievable. So yeah, there is no stigma here. This is the norm. Yeah. So.
That's difficult, and we're out of time. I hate to end like that, but
sorry.
That's okay. Our final session is next Thursday, where we're going to discuss the feasibility of engaging local policymakers in the work of addressing food insecurity and community health. Do you have any issues or ideas you'd like to see discussed during this conversation? Anything you want to emphasize or something that hasn't come up? Okay, well, it's been a rich conversation, so I'm sure there's a lot we can tap into that we can then discuss next Thursday. Anyone else watching has any questions or comments they want to share? Well, great. We're at the end of our time for today's session. Many thanks to our panelists, the Palatine Foundation of Huntington, our attendees, and for this great conversation. The video for today's discussion will be posted on our YouTube channel tomorrow. So be sure to share with friends and colleagues who care about this issue, and we hope to see you on social media to keep the conversation going. Join us next Thursday, where we'll discuss policy change at the local level. Can we engage local policymakers in the fight for food accessibility for all? That's it. Thanks so much, and have a great day, everyone.
Thanks,
Thank you.
everyone.
Thank you.
Nice to meet everyone.